What is isolated systolic hypertension? Well, that's an interesting phenomenon. What happens as we age, our systolic blood pressure goes up. But what happens to our diastolic? Well, the first few years, it's also going up. So what we have is, we have systolic, diastolic hypertension. But what happens when we hit around our mid-50s? This diastolic starts going down. What's the significance of that? Well, this change in blood pressure is isolated systolic hypertension because the diastolic is either normal or below normal. What's the significance of having isolated systolic hypertension? The question is systolic, diastolic hypertension treated the same as isolated systolic hypertension? Well, as a matter of fact, if you go to the Canadian Hypertension Guidelines, what you'll find is that systolic, diastolic hypertension is treated differently from isolated systolic hypertension. For systolic, diastolic hypertension, if you have no other comorbidities, then you can use diuretics, you can use ACEs, you can use ARBs, calcium channel blockers, or beta blockers if you're under 60. But if you have isolated systolic hypertension, there's only 3 classes of medications you can use. You can use diuretics, you can use ARBs, angiotensin receptor blockers, or you can use calcium channel blockers. So when you're treating your blood pressure, it's important to know, do I have systolic, diastolic hypertension? Do I have isolated systolic hypertension? And what are my comorbidities? Based upon this information, your doctor will come with the right combination for you. And when he does that, make sure you take your medication as prescribed.